Welcome to Inspired Caregiver with me, Michelle Magner. This is the podcast where people who are helping out their older family members come for information, tips, and inspiration on how to make their journey easier. Enjoy this episode of Inspired Caregiver. Welcome back to Inspired Caregiver. Hope you are having a really good day. I wanted to share with you a conversation I had with a nurse and a C.N.A. recently. They are in an environment where they are caring for older people and watching and listening and participating and engaging with families as well. So they see the family caregivers in action. And I asked them recently what they would like to share with you. So if you are caring for someone that is older, which I would think you are since you are listening to this podcast, their messaging for you is to slow down. Just slow down. Something that they have observed that is of concern to them is that families are in a rush, in a hurry, and just in general want everything to be at a faster pace than what their family member is able to do or is doing. So an example would be your speech pattern. When you're talking with your family member, talking really fast can be a real challenge. One of the things that's really important to remember is that if someone has a hearing impairment, there's potential, especially if they don't have assistive devices like hearing aids, there's potential that they're only capturing 3 out of 4 words if they are hard of hearing. If someone has dementia or another cognitive impairment, or if maybe they're coming off anesthesia or something else, when you are speaking to them, they may be missing 2 to 3 out of 4 words. So families are constantly frustrated because they feel like the person that they're trying to communicate with isn't responding or understanding or listening or hearing, but really it's that they're just struggling to process what you're saying and how fast you're saying it. So that is one example of slowing down. Just slow down your language and then provide some time for someone to respond. So instead of peppering someone with questions, which I understand, we're in a rush, we're in a hurry, we're trying to get things taken care of. Instead of peppering them with questions and then getting just annoyed and frustrated that they're not answering you fast enough, slow down your pattern. So you would ask, "Are you ready for dinner, Mom?" And then give them a few seconds to respond. "Where would you like to go?" And give them some time to respond. So just in general, not just with speech patterns, what is being observed is families are constantly trying to rush people, and the injury is a big concern, they said as well, because people just can't move and hustle as fast as the family members would like. So that is my thought for today that I wanted to share with you. I was really happy that these people, this nurse and C.N.A., certified nursing assistant, were willing to share with me really valuable tip to share with you. So I hope you find that helpful. I hope you are doing okay. It's getting kind of weird out there again. And I know as family caregivers, the isolation is still prevalent. It's still strong regardless of pandemics or not. So I hope you are staying connected with other people, and I love you. So take care of yourself. We'll talk to you next time.